When my husband and I were planning on having children, we never foresaw health issues with our little baby boy. And so when at 3 months old, Magnus was diagnosed with tracheomalacia, and then at 8 months old, he was diagnosed with a heart condition, we were devastated. Our hearts just ached for our son, and putting this little baby through all of these tests and having surgery and knowing that he was going to have scars on his body the rest of his life and he hadn't even learned to walk yet. That was really incredibly painful. All that lost time of work, all the expenses of travel, and then the medical insurance, obviously was quite expensive. So we drained our savings trying to take care of him. What really financially threw us over the edge was when our son broke his arm this summer, and all of a sudden, when I thought we only had a few $1,000s left to pay, now we're up to nearly $10,000 again. When these bills come along, it takes away a lot of your hopes and your dreams that you have been financially planning for.
My husband, Tim, had some heart issues, ended up with open heart surgery, and then was unable to go back to work. We'd been here about 4 or 5 months. Bad winter, lots of snow, and Tim did a lot of shoveling, complained a lot about his back. And so they did an MRI and found multiple lesions in his spine. So from there, diagnosed him with multiple myeloma. That changed life totally. I was just building a practice here, and then I had to put all of my new clients on hold. It was just a challenge not having the finances that we had had before. Since I'm self-employed, my deductible is quite high, and so it was an easy choice for me to want to go to that Healthcare Connections bus to take care of myself, because if I couldn't stay healthy myself, what would happen to my husband, Tim?
Healthcare challenges can strike anyone at any time, young or old, native or newcomer, farmer or banker. None of us are immune from the challenges and stresses associated with unplanned medical expenses. Bozeman Health conducted a community needs assessment, and the results were, quite frankly, shocking. To learn that folks were putting off essential services, screenings, immunizations, wellness checkups because of issues related to a family budget or the fact that they didn't have insurance. Bozeman Health recognizes that we need to bring the resources to the folks who need them most. That could be outreach through our Community Connections program. It could be health fairs. And it's also helping folks with the financial burden of medical care.
When Bozeman Health came to us and said, we are going to pay a portion of your bill, it was such a game changer for us. We were so grateful to Bozeman Health and the positive impact that it had on our family.
The Healthcare Connections bus gave me that motivation to get more active. It's not charity, it's not welfare, it's not anything except a great service that the community offers.
Bozeman Health's mission is to improve community health and quality of life. But we provide more than just health care. We provide compassion, we provide dignity, and we provide hope.
Magnus is the smiliest, happiest, healthiest little boy you've ever seen. We always tell him he was born with an extra big heart. And whenever I see the scar on his back, it reminds me that he went through this, because otherwise you wouldn't know it. Things are looking up for my family, and Bozeman Health's financial assistance has helped us look to the future with more hope and realize that our dreams can come true, of buying a new house, of taking vacations with our kids, of doing these things that we've had to put on hold for so many years. And now we're starting to see the light at the end of the tunnel, which has been really exciting for us.